Good morning. You're watching the news right here on CNN News 18. My name is Toya Singh. It's a Tuesday morning. Thank you for choosing to start your day with us. Now, over the next hour, we're going to walk you through all of the breaking news stories coming in from across the country. Our first story focuses on the COVID approach that the country is taking. As our neighboring nation of China sees a surge in COVID cases, India is gearing up to prevent any possible COVID-19 crisis. Now, on the left side of your screens, Union Minister Mansukh Mandavia. He was present at the Safdarjung Hospital a little while earlier today. He's overseeing a mock drill. We'll walk you through exactly what that is in just a second. States across the country are conducting mock drills. What they're looking to see is how prepared the hospitals are to deal with a possible spike in cases. Now, I do also want to walk you through more details about what's taken place so far. Yesterday, the health minister held a virtual meeting with the IMA, that's the Indian Medical Association. They stressed the importance of the need to ensure that Indians everywhere across the country get their booster doses and mask up. Now, we'll bring you more details. It's important to note also that the Karnataka government has made it mandatory to wear masks. They've issued fresh guidelines for the new year. They've become the first state to return the mask mandate. Now, those are the details we have with us so far. I'll wait to see if colleagues of mine are connected to understand if we can connect you to ground reports. My colleague Akshara is with us from Bengaluru right now. We'll go over to him to understand more. Akshara, good morning. Akshara, walk us through the Karnataka government's thinking. We've just told our audiences they were the first government yesterday to make two announcements. A, that masks were now important, necessary, and B, that masks and early finishing of any New Year celebrations would be expected come December 31st. Could you walk us through what led to the government making that decision?
Yes, as you rightly mentioned, masks have been made mandatory in indoor spaces and also in places inside where AC is put. And right now, the Karnataka government has also, as per the instructions from the government, there's mock drill taking place. Here we are at C.V. Raman Nagar Hospital, where a mock drill is taking place, which has started. And here we are at the main cell where oxygen. For example, if you take a look at this hospital, outside we have two main oxygen generating plants from which the oxygen will be provided. If there's less oxygen, lack of oxygen there, we have, this hospital has a stock of jumbo cylinders here. Here we have 156 jumbo cylinders from which if there's a lack of oxygen there, this will be used as backup. So right now here, as we can see, the dry run of the oxygen dry run is taking place, and right after this, all the precautionary measures and the checking of the beds as well, ventilators will be taking place, which is a part of the mock drill. And the Karnataka government is also emphasizing on the precautionary dose which needs to be taken, and awareness program will be conducted as well. So right now mock drill is taking place, and the Karnataka government will be emphasizing, and awareness program will also be done in order to advise people to voluntarily come forward and take the precautionary dose. So this is the recent update here in Bengaluru.
Okay. All right. Could you also bring us a quick update on the one case that was spotted, I think, day before yesterday? I think it was a case that had come in with a travel history from China. What took place after that, Akshara?
Right now, after that, another meeting was conducted by the health minister, and as you mentioned, the second point as well, strict curbs have been put up for the upcoming New Year celebrations as well, and as you know, precautionary measures will be taken, and also regarding this one, which the New Year celebration will be taking place. The celebration will be taking place from 12 to 1 a.m. It must be over by 1 a.m. So that's the strict measure which the government has advised, because it's a cold chill night as well, which will be taking place during that time. So that's one strict advice given by the government. As I mentioned before, the Karnataka government's emphasis is on the precautionary dose.
Okay, all right. Let's go over now to my colleague Shireen. Shireen is with us from live at the Safdarjung Hospital, which is where the Union Health Minister Mansukh Mandavia was a little while ago. He was overseeing the mock drill taking place there. Shireen, what is a mock drill?
Well, a mock drill, the whole plan of a mock drill is basically to see how well equipped the hospitals in the country are. Now, this whole point of mock drill came in when we have seen how there was in fact COVID rise in countries like China, South Korea, also in Japan and US, and accordingly it became in fact a situation where we had to be ready in case the situation goes out of hand, especially because BF7, there are about 4 cases of BF7 in the country at the moment, and that is a subvariant of Omicron. And we have seen in the first wave, we have seen in the second wave as well. When it hit us, there were a lot of things that came as a shortage. In the first wave, the PPE kits, the gloves was in fact a shortage. In the second wave, of course, the oxygen was in fact a shortage. The first wave, it was very new to us, not just to us, but for the entire world. It was very new, so it was very difficult to understand how to go about it, what is the process. Now once again, when we have in fact BF7 cases and when there are cases that is increasing across the world, the government of India wants to be well prepared for the situation, and that is why one such exercise to see how prepared are we is the mock drill. Now there are 9 factors under which this mock drill is going to be in fact implemented. One is how well resourced are we. The oxygen PSA is going to be looked into. The testing, how are the testings being done. Apart from that, the ambulances, the staff, what is the presence of the staff in each hospital, the PPE kits, the gloves, the mask, all this. It is kind of a refresh or a revival of what we had in the first and the second wave. How prepared are we? To give you an idea of what is really happening in this mock drill, first the patient will come inside, he or she will enter the triage area, which is the area where in fact the testing is going to happen. Once the testing is done, this is the patient entry, the COVID testing area is this. Once the testing is done, the patient will have to wait at the doffing area till the result comes. Now there are 2 types of tests that is going to be conducted here at Safdarjung Hospital. One is the antigen test, which the results come in 15 minutes. The other is a TrueNet test, in which the result will come around 1 hour. And the third one, of course, we all know is the RT-PCR test. Now, depending on the situation, whether the patient is positive or negative, the patient will be shifted to the isolated beds. Now, there are about, in Safdarjung Hospital, there are about 20 isolated beds in COVID center, and after which, depending on the severity of the infection, the patient will be shifted to Sari center, where the ICU as well as the ventilator beds are available. So this is a way to know that how prepared are we. Now just half a meter away from here is the oxygen PSA. Remember, there are almost 600 PSAs that has been installed. Once we saw the situation in second wave, where the situation was in fact, there was oxygen shortage, the medical oxygen was not available because of the distribution error at some point, and that is why the government of India made sure that we have PSA plants in each of the hospitals in districts nearby, so that the oxygen shortage should not something that should be repeated like we had in second wave. So that's why we have over 600 such PSAs, and they need to be revived. Whether the condition of the operational work is being done or not, that will be checked in this particular mock drill. So across the country, the mock drill is happening.
Okay.
The Union Minister came to the to Safdarjung Hospital in the national capital. The MOS of Health Ministry, Bharti Pawar, is in fact in Port Blair. So you can see from the top to the end, each of the states are going to conduct this mock drill to be well prepared for the situation.
Shireen, just stay with us.